All right, 12.3, disorders of the lymphatic and immune system. Disorders of the lymphatic system. Physicians routinely palpate accessible lymph nodes in the neck, cervical nodes, axillary nodes, the axilli, and groin, inguinal nodes for enlargement and tenderness. Their presence indicates disease in the tissues drained by the lymph nodes. Cancerous lymph nodes are enlarged, firm, and usually painless. Infections in the lymph nodes cause them to be swollen and tender to the touch, a condition called lymphadenitis. All lymph node enlargements are collectively called lymphadenopathy. Lymphoma is a malignant neoplasm of the lymphatic organs, usually the lymph nodes. The disorder usually presents as an enlarged, non-tender lymph node, often in the neck or axilla. Lymphomas are grouped into two categories. First is Hodgkin lymphoma, characterized by the presence of abnormal cancerous B cells called Reed-Sternberg cells. These are large cells with two nuclei resembling the eyes of an owl. The cancer spreads in an orderly manner to adjoining lymph nodes. This enables the disease to be staged depending on how far it has spread. And second is non-Hodgkin lymphomas. Occur much more frequently than Hodgkin lymphoma. They include some 30 different disease entities and 10 different subtypes. Okay. Tonsillitis, inflammation of the tonsils and adenoids, occurs mostly in the first years of life. The infection can be viral or bacterial, usually streptococcal. It produces enlarged tender lymph nodes under the jaw. Splenomegaly, an enlarged spleen, is not a disease in itself but the result of an underlying disorder. However, when the spleen enlarges, it traps and removes an excessive number of blood cells and platelets, hypersplenism, and reduces the number of blood cells and platelets in the bloodstream. The potential causes of splenomegaly are numerous and include infections such as mononucleosis, lymphomas, anemas such as sickle cell anemia, and storage diseases such as Gaucher disease. Ruptured spleen is a common complication from car accidents or other trauma when the abdomen and rib cage are damaged. Intra-abdominal bleeding from the ruptured spleen can be extensive, with a dramatic fall in blood pressure. Lymphedema is localized, non-pitting fluid retention caused by a compromised lymphatic system, often after surgery, radiation therapy, or removal of lymph nodes to determine the presence of cancer cells. It also can be primary, where the cause is unknown. Okay, Hodgkin lymphoma, named from Thomas Hodgkin, lived 1798 until 1866. He was a British physician. Disease marked by chronic enlargement of lymph nodes spreading to other nodes in an orderly way. And hypersplenism, condition in which the spleen removes blood components at an excessive rate. Lymphadenitis, inflammation of the lymph node. Lymphadenopathy, any disease process affecting a lymph node. Lymphedema, tissue swelling due to lymphatic obstruction. Lymphoma, any neoplasm of lymphatic tissue. Splenectomy, surgical removal of the spleen. Splenomegaly, enlarged spleen. Tonsillectomy, surgical removal of the tonsils. Tonsillitis, inflammation of the tonsils. Disorders of the immune system. Hypersensitivity is an excessive immune response to an antigen that would normally be tolerated. Hypersensitivity includes allergies, which are reactions to environmental antigens such as pollen, molds, and dust, to foods such as peanuts, shellfish, and eggs, to plants such as poison ivy, to sunlight, and to drugs such as penicillin, as well as asthmatic reactions to inhaled antigens. Abnormal reactions to your own tissues is an autoimmune disorders. Reactions to tissue or to fibrous tissues, reactions to tissues transplanted from another person is alloimmune disorders. Because of this immunosuppressive drug, 75% of all solid organ transplants will be newly affected with cytomegalovirus CMV following organ transplantation. In most allergic hypersensitivity reactions, allergens, antigens, bind to IgE on the membranes of basophils and mast cells, and within seconds of exposure stimulate the cells to produce histamine. This triggers vasodilation, increased capillary permeability, and smooth muscle spasms. The symptoms produced by these changes include edema, mucus hypersecretion, and congestion, watery eyes, hives, urticaria, and sometimes cramps, diarrhea, and vomiting. Anaphylaxis is an acute, immediate, and severe allergic reaction. It can be relieved by antihistamines. Anaphylactic shock is more severe and characterized by dyspnea due to bronchial constriction, circulatory shock, and sometimes death. It is life-threatening medical emergency, requires immediate epinephrine and circulatory support. Asthma is triggered by allergens. As listed earlier, and by air pollutants, drugs, and emotions. These all stimulate plasma cells to secrete IgE, which binds to cells in the respiratory mucosa and releases a mixture of histamine and interleukins. Within minutes, the bronchioles constrict spasmodically, bronchospasm, leading to the wheezing and coughing of asthma. Autoimmune disorders are an overvigorous response of the immune system in which the immune system fails to distinguish self-antigens from foreign antigens. These self-antigens produce autoantibodies that attack the body's own tissues. This type of response occurs, for example, in lupus, erythematosus, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, and psoriasis. Immunodeficiency disorders are a deficient response of the immune system in which it fails to respond vigorously enough. They are in 3 categories. First is congenital inborn, caused by a genetic abnormality that is often sex-linked, with boys affected more often than girls. An example from among the 20 or more congenital immunodeficiency diseases is inherited combined immunodeficiency disease, in which there is an absence of both T cells and B cells. Affected children are very susceptible to opportunistic infections and must live in protective sterile enclosures. Second is immunosuppression, a common side effect of corticosteroids in treatment to prevent transplant rejection and in chemotherapy treatment for cancer. These drugs reduce the numbers of all lymphocytes, making it possible for opportunistic infections to invade the body. Acquired immunodeficiency, a result of diseases such as acquired immunodeficiency syndrome AIDS that involve a severely depressed immune system from infection with the human immunodeficiency virus. Immunology of transplantation. The success of any organ transplantation is based on control of the recipient's immune system to prevent rejection of the allograft tissue from another individual of the same species. Transplant immunity is designed to cause rejection, and both cellular and humoral defense mechanisms are involved. To try to prevent this, the recipient and donor must match at both the human lymphocyte antigen HLA and blood group system ABO types. A combination of immunosuppressive drugs is used to control graft rejection, but the drugs have adverse side effects on the recipient. One combination is corticosteroids with cyclosporine or FK506. Other drugs are in clinical trials. Okay, allogen, allo meaning strange and different. Okay, and Jen is producing antigen from someone else in the same species. Allogenic as an adjective pertaining to allogen. Allograft, tissue graft from another person or cadaver. Alloimmune, reaction directed against foreign tissue. Anaphylaxis, immediate severe allergic response. Anaphylactic is pertaining to anaphylaxis. Autoantibody, an antibody that reacts with a person's own cells and tissues. Histamine, a compound liberated in tissues as a result of injury or an allergic response. Amine means nitrogen containing. Hist is derived from histidine. Antihistamine is a drug used to treat allergic symptoms because of its action antagonistic to histamine. Hypersensitivity, exaggerated abnormal reaction to an allergen. Immunodeficiency, failure of the immunosystem. Immunosuppression, suppression of the immune response by an outside agent such as a drug. Transplant, the tissue or organ used or the act of transferring tissue from one person to another. Transplantation, the moving of an organ from one person or place to another. And urticaria, Latin for nettle, it means rash of itchy wheals or hives. All right, viral infections. Viruses are the smallest of the microorganisms. Viruses spread from person to person through coughs, sneezes, and unwashed hands. Did you know between November 2002 to July 2003, there were 8,098 SARS cases worldwide and 774 deaths? Since the start of the COVID pandemic to January 30th, 2022, the CDC reported 350,000 deaths involving COVID in the United States. Viruses cause specific childhood diseases like measles, rubella, German measles, rubella, rubiola, like measles, rubiola, German measles, rubella, chickenpox, varicella, and mumps. They can cause upper respiratory infections, including modern respiratory infections like severe acute respiratory syndrome, SARS, avian influenza, bird flu, and West Nile virus, WNV. West Nile virus is a seasonal epidemic in North America that flares up in summer and fall. I just remembered the picture my mom took of me when I was in preschool and I got chickenpox. And I was on a playground at Mickey's Grove. Anyway, she put me in like a red polka dot outfit while I had chickenpox. And then I'd seen the picture later and she goes, yeah, maybe it wasn't the best choice. But, it was clean. Okay. All over my face. Still have like a scar somewhere up here, probably from picking at it when I was a kid. Influenza, flu. These are 3 types of influenza viruses that affect humans. Types A and B cause seasonal epidemics and spread through respiratory droplets. Symptoms include fever, malaise, cough, headaches, and sore throat. Coronavirus. A coronavirus is a type of virus. A new type of coronavirus emerged in 2002 that was associated with the severe acute respiratory syndrome SARS-associated coronavirus, SARS-CoV. Coronavirus 2019, COVID-19, is a previously unrecorded novel CoV associated with severe respiratory illness, SARS-CoV-2, classified as a pneumonia. As of 2020, research reports that COVID-19 infected people with no symptoms have low levels of IgM. Severe symptomatic people have high levels of IgA, which is found in mucous membranes. Severity of illness may be due to cytokine storm syndrome causing a hyperimmune response. SARS-CoV-2 is actively being researched for its effects on the human body. HIV and AIDS. Why can't I focus this thing on me? Oh wow. Alright, HIV and AIDS. Human immunodeficiency virus, HIV, is one of the group of viruses known as retroviruses. Like other viruses, it can replicate only inside a living host cell. HIV invades helper T, CD4 cells, and cells in the upper respiratory tract and CNS. Inside the cell, the virus generates new deoxyribonucleic acid, DNA, and can stay dormant in the cell for months or years. When it is activated, the new viruses emerge from the dying host cell and attack more CD4 cells. This dormant phase incubation can range from a few months to 12 years. The CD4 cells are the central coordinators for the immune response. As the virus destroys more and more cells, the CD4 count falls, and antibodies can't be produced. Symptoms appear, including chills, fever, night sweats, fatigue, weight loss, and lymphadenitis. When CD4 cells are very low, opportunistic infections by bacteria, viruses, and fungi can occur. These infections include toxoplasmosis, pneumocystis, tuberculosis, herpes simplex, cytomegalovirus, and candidiasis. If human immunodeficiency virus HIV invades the brain, it causes dementia. Cancers can also invade and a form of malignancy called Kaposi sarcoma is often seen in association with acquired immunodeficiency syndrome. HIV is found in blood, semen, vaginal secretions, saliva, tears, and breast milk of infected mothers. The most common means of transmission of HIV are sexual intercourse, vaginal, oral, anal, sharing of needles for drug use, contaminated blood products. All donated blood is now tested for HIV. Transplacental from an infected mother to her fetus. The virus survives poorly outside the human body. It is destroyed by laundering, dishwashing, chlorination, disinfectants, alcohol, and germicidal skin cleansers. In the United States, the number of HIV diagnoses declined about 19% from 2005 to 2014, but diagnoses have increased among certain groups and certain geographical regions, so new infections continue to occur. See, dormant is inactive. Dorm means sleep. Endemic, pertaining to a disease always present in a community. Epidemic, pertaining to an outbreak in a community of a disease or a health-related behavior. Pandemic, pertaining to a disease attacking the population of a very large area. Hyperimmune, an increased titer of antibodies in response to antigen. Incubation, incube is sit on and hatch, process to develop an infection. Influenza, Latin, caused by the influence of heavenly bodies, acute viral infection of upper and lower respiratory tracts. Novel, Old French for new or fresh, not previously identified. Opportunistic, take advantage of. Ist is agent, pertaining to an organism or a disease in a host with lowered resistance. Retrovirus, virus that replicates in a host cell by converting its ribonucleic acid RNA core into deoxyribonucleic acid DNA. Sarcoma, a malignant tumor originating in connective tissues. Sarc means flesh. Kaposi sarcoma, named from Moritz Kaposi, born 1837, died 1902, and a Hungarian dermatologist. A malignancy often seen in AIDS patients. A virus, Latin for poison, a group of infectious agents that require living cells for growth and reproduction. Viral, adjective, it means pertaining to or caused by a virus.